The reason I talk about this is the feeling of sense of responsibility. What happened to me shouldn't have happened, and others also experienced it, but I've been lucky enough to survive it and to be able to understand the things that went wrong. We all think we're safe. I thought I would be safe. You think that if something goes wrong, you'd know who to speak to. Intelligent people, you'd know who to contact. And I was in a good hospital. But the fact is, when things go wrong, you are entirely reliant on strangers, sometimes one individual. And you hope that those decisions and actions they take at that moment in time will have the right outcome. But you're often alone, you've got no one to contact, and loved ones take reassurance that you're in a safe place. And the outcome when it goes wrong can be quite devastating. My story and why I talk about it isn't a case of blame or retribution. It's about people trying to learn and understand so that it doesn't happen to other people and people don't suffer in the way I have, or my parents have, my brother, my sister-in-law, my nieces and my friends, because they shouldn't have experienced or seen the things they saw. It started 6 years ago on the 5th of March 2013, on a day pretty much like the day we're sitting in, with sunshine, spring morning. I had left the office to drive home to go into London for a meeting in Westminster. Only I didn't get home, and I didn't get home for another 3 months. On the journey home, I saw a car in front of me braking, and I thought, as any normal person would, it was a cyclist or there was a deer. So I started to brake too. And in an instant split second, I saw another car coming from the other side of the road, straight for me. There was nothing I could do. There was no time to react. It was a case of just hoping it wouldn't hurt. Your body takes control in those times because it's just noise, shaking. And I simply remember waiting for my legs to break and hoping that I'd be alive. And as the car came to a standstill, it was backwards in a ditch. And I was just thinking, what way up am I? I'm still alive, I'm still breathing. And that was just a sense of relief. But there was no comprehension about really what happened or how. I was in absolute agony. My abdomen was in agony. And I remember undoing my seatbelt, trying to reach for my phone. So I thought I needed to call someone. I couldn't reach my phone, I was in too much pain, and simply thought someone will have called someone. The windows were all smashed, and I could feel sort of the cool air coming in. And there was someone holding my hand through the window, who I now know is a lady called Marilyn, who was actually a ambulance transporter lady who was driving a patient transport ambulance and was first on the scene. And my vision was going at that time, and I couldn't see anything, but I could just hear her voice and her saying to me, "It's okay, the emergency services are on their way." And I could hear the alarms in the background. Time sort of changes in terms of its context, and I remember there being the fire service inside the car with me, plastic sheeting over me, paramedics in the car putting lines and oxygen on me, and them trying to cut me free. And I didn't really have a appreciation for what had happened, and I thought it was all a little bit of too much drama and excessive. The next thing I knew was hearing that a helicopter was landing, and they were talking about how they were going to try and get the patient to the helicopter. And all I remember thinking is, poor person, there must be someone really badly hurt. And I was worried about the car in front. But within seconds, I realised that they were talking about me. You can't really quite process it. I was just focused on staying calm. I was in pain, but I thought, my legs aren't broken, my arms aren't broken, I can't see any blood. I remember very little. I remember being loaded into the helicopter vaguely and the face of the doctor. I don't remember us landing at hospital. I don't remember us really sort of arriving in resus. I have a vague recollection of lots of people being around and being in excruciating pain. It's sort of a bizarre scenario because you don't want to cause a fuss and you don't want to cause alarm, and in my head I was still trying to think that I was okay, but I was completely off my head on morphine by that time. I'd been airlifted with suspected fractured pelvis and internal injuries, and I was taken for a CT scan. I have a vague memory of my clothes being cut off and being asked to hold my breath, which I remember being excruciating and not being able to do. The only other memories I have from that point are from screaming at my father to press the morphine button, and also of my friend coming to visit me. I remember being out the pattern on her dress, but apart from that, it's very vague. But what actually happened was that evening after the accident, I was admitted to the surgical emergency unit. There was concerns about the swelling in my abdomen, the extensive bruising across my abdomen, my chest. The CT scan had shown no free air, but some free fluid. So they admitted me overnight. In the morning, there was the ward round. I was assessed, still in excruciating pain, still bruised and swollen, and the pain team were involved to try and manage the pain. I was also catheterised at that time because I was in so much pain I couldn't stand. And over the course of that day, the nurses, the doctors called for reviews. The pain was uncontrolled. And by the evening, I had started to vomit as well. The decision was that I had constipation due to the pain relief, and it was bruising to the abdomen, and therefore I was given enemas and laxatives. I have no recollection of this. I also know at this point my heart rate was starting to rise. I believe at this point it was about 120. I was still in excruciating pain. And over the course of that night, the Wednesday night, the pain was still uncontrolled. The nursing staff were still alarmed and were calling for help. And one of the nurses documented in my notes the need for an X-ray or another scan because she felt something was wrong. And by the morning, I was still in the same state, deteriorating. My heart rate was now, I think, 120 to 130. My abdomen was swollen and distended. There was no bowel sounds. I had a drop in my white cell count. And there were concerns. And my notes said antibiotics on hold, scan was cancelled, and there was calls for just more pain relief. At this time, I was texting absolute nonsense. I was fading in and out of consciousness. I was telling friends not to worry. Friends who were medics were taking reassurance the fact that I was in a good hospital. I was in a safe place. The nurses throughout that day were calling for reviews, and I know in my notes there were reviews by registrars without action or the review being not documented. My parents asked the pain team why I was in so much pain, and the fact that if I was in so much pain, surely there must be something wrong. And they were, my mother says, it was kind of shrugged, and they said, oh, we don't know, and walked off. My parents have always, of a generation where you have respect for the medical profession, you're polite to people, and you don't cause problems. So if someone is telling you that's the answer and you're concerned, you respect the medical profession. And I was telling them not to worry. I was telling my friends not to worry. I didn't want to cause a fuss. They asked, I had told my parents that another scan had been planned, that the nurses had told me that another scan had been planned. I don't recall this, my mother recalls this. And when she asked one of the nurses why the scan had been cancelled, she was told that another member of staff had said that I was just being a silly little girl that couldn't take the pain. As that evening progressed, my parents left the hospital concerned. One of my best friends came to see me with her husband. And that evening, she arrived to find me vomiting bile, lying in a bed, not really able to move, with a distended abdomen. And I made her touch it because I was joking that I looked 9 months pregnant, and she said it was hard and distended. Before she'd arrived, I'd been texting her to say that the nurses may be with me because my catheter had kept coming out because the pressure in my abdomen was so great. They left the hospital concerned, worried, not really knowing what to do, not knowing who to ask for help, but again, trusting what they'd been told, trusting what I had told them about not to worry, that I was in a safe place and in a good hospital. And even in the last month, my friend has said she still feels guilty, feels that she should have done more, but she wasn't in a position or empowered to do so. That night, I deteriorated further, and as midnight approached, my heart rate rose to about 150, 180. I was given Buscopan, and the elevation in heart rate was attributed to an anaphylactic shock to the Buscopan, although there was no action taken against the anaphylaxis. The registrar was called, but there was no notes in my recorded that the registrar was called. And this was about 1 o'clock in the morning. I was cold, clammy, flaccid, only responding to voice. I was alone, unable to contact anyone, not conscious enough, not able enough, and with my friends and family completely unaware of what was happening. At that time, I was completely reliant on a few people to take some action. But for 4 hours, between approximately 2 o'clock and 6 o'clock in the morning, there were no further observations recorded on me, despite me being attached to the monitors. By the morning, when the junior doctor arrived, she was concerned and called for senior review. My blood pressure had dropped by this point. My heart rate was sky high. And many of you may have guessed what had happened. During the car accident, my bowel had been perforated, my jejunum. And during the 3 days that I'd lay in hospital, peritonitis had taken hold that had led to severe septic shock. And I was by now in organ failure. The consultant arrived at about 1:45, so quite a long time afterwards. Warming blankets were called for, fluid resuscitation, and ICU were contacted. I was rushed for a CT scan and to emergency theatre. During this time, my parents were driving to the hospital. They had driven from their home to stay in my house to be closer by, with the anticipation that they would be taking me home. Instead, they arrived at an empty bed, which sounds sort of cliched, and they were taken to a side room and explained that they needed to go to intensive care in an hour's time, and they were handed my belongings. In theatre, I was unstable throughout, and I understand damage limitation surgery was carried out. I had 4-quadrant sepsis in my abdomen and in heart failure. I was left open, my abdomen open, taken back to intensive care. And my parents described the conversation they had with the consultant as being told the facts of life. They were told that to survive the night, I would need the heart of a marathon runner. And it's probably the thing that my parents gripped to, because I was a bit of a gym junkie at the time. I was a runner. I was probably as fit as I could possibly be. But I was fighting. And the next morning, the Saturday, was actually my 35th birthday, which probably only served to intensify the enormity of what my parents were fighting for. I'd been a fit 34-year-old, and now I was lying in intensive care on life support, fighting for my life. If that wasn't hard enough, the next day, the Sunday, was actually Mother's Day, and my brother travelled over to see me, not knowing if he would ever see me again. He tells me that I didn't look like me. I looked like wax, and I was cold to touch. And there were discussions at this point that more surgery was needed, but it was trying to make the balance between me being stable enough and strong enough for surgery and the swelling in my abdomen. And as the Sunday turned into the Monday, the decision was taken to take me back to theatre, which ironically was 6 years ago today. So as we sit here 6 years ago, they were preparing my bed in intensive care with my parents, with a vigil, to take me back to theatre for more surgery. After many hours and with a specialist bowel surgeon, they did manage to repair my bowel. They removed a portion of ischemic bowel due to the septic shock and returned me to intensive care. But by this time, I now had pneumonia I had right ventricular failure, left ventricular failure. And by no means was I out of the woods. And 2 days after that second surgery, my heart was still not looking good. As much as fit as I was, my body couldn't take it anymore. And on the 13th, my heart stopped. The first time, I understand my parents were with the consultant, but I do know that one of the times my mother was with me and she saw my heart go from tachycardic to severely bradycardic. And as people who are in intensive care probably can imagine, they know what would have happened. CPR was commenced. I'm not sure entirely the number of times it happened. I understand about 4 times over the next 24 hours. And following that, I then had signs of an NSTEMI and was treated for acute coronary syndrome. But somehow, I don't know how, my body managed to pull through that. And about 2 weeks after the accident, they made the decisions to start bringing me out of the coma. But you don't just wake up from a coma. They gradually brought me out of the coma, but it was clear I was suffering from ICU delirium, psychosis. So they sedated me again and tried again the next day. And over the course of those days, they brought me round. And I remember waking up. I remember not really knowing where I was. All I could see were other patients. And my memory of the reason I was there was not from a car accident. I thought I was there because I'd been kidnapped, because I'd been raped, tortured. And as I looked around, I thought I was in an experimental laboratory. I could see a patient with a cage round their head. I could see another elderly lady in a bed, and I could see blood just flowing out of the bottom of my bed. And I was looking for the face of the murderer, because these people have faces and they have names. But then I heard a voice, and it was a nurse, and she just smiled at me, and she said to me, "Your parents are going to be so pleased to see you awake." And at that moment, there was just the enormous sense of relief, because I just felt safe. I didn't really know I was in hospital. I didn't know I was in intensive care. I just knew I'd been rescued. And the next thing I remember is my mother's face at the left-hand side of my bed, but I was unable to move. I still had the tube in my mouth. I could feel it. I couldn't really move my mouth properly, and I could only move the left finger on my left hand. And over the next few days, the tubes were taken out. I was unable to move. I remember the physios coming to help try to sit me up in my intensive care bed. And after a few days, I was transferred back to the surgical emergency unit, back to the ward where I'd originally been. But I don't actually remember ever being there. It was all completely new, and I had people talking to me as if they knew me, and they couldn't understand why I didn't recognise them. I was unable to move. I was being fed through a tube in my neck. I had drains in my side, had lines going into every arm. My arms, my body, my legs were all swollen, stretched. And my hands were elevated on cushions, and my skin was all shiny, as if it was about to split. And I couldn't breathe properly. I couldn't cough. And about a week later, I remember my boyfriend coming to see me at the time. He was a medical consultant at a different hospital. And I remember that evening, him coming to see me. And I have a vague recollection of him talking to me. I wasn't able to move. And I remember him asking about my heart rate. And the nurse said, "Oh, that's because you're holding her hand." I was aware slightly of people talking at the bottom of my bed, him asking to see my notes, and him having to travel back home because he had his own work to do, his own clinics to go to. And the next thing I knew was more nurses around me, and it transpires I was septic again, but this time from my central line. I was told that they couldn't remove the central line because it would be too dangerous on the ward to do so. I wasn't in a position to understand what was happening. Your brain is not working. It shuts out everything when you're that sick. Fortunately, my boyfriend had contacted ICU to let them know what's happening, having obviously built a relationship with him while he was there and knowing how to deal with these situations. And actually, probably half an hour, 45 minutes later, there was 2 doctors from ICU who'd come to see me to remove the central line. And I remember feeling frightened because I'd been told they couldn't take the central line out because it would be too dangerous to do so on the ward. I hadn't realised that these were doctors from ICU that had come to see me specifically. I remember the doctor saying to me, he said, "Oh, don't worry, we put these in all the time. In fact, I think I put this one in for you." They laughed, they joked, they smiled, reassured me, and I felt safe. But that still wasn't the end of the story. I was still unable to move, and I had a long way to go. I had to learn to eat again. I had to learn to move again. My heart rate was still at baseline of about 150, 160 with septic cardiomyopathy. I had bilateral effusions causing my lungs to collapse. I had liver abscesses. My abdominal wound came undone due to the fact I was so sick. So that was being packed every single day. I then developed a jugular clot from the central line, so I had to be anticoagulated. And at the same time, that was causing problems and discussions about chest drains being inserted to relieve the pressure and the effusions to help me breathe. I remember coming back from the scans for the clot, and it was probably one of the evenings, the one times I actually cried in hospital. I'd come back to the ward. I remember seeing the faces of my parents, and you put on a brave face. I didn't want them to know that I was scared. They'd already been through so much, although I had no idea at that point what actually had gone on, and I hadn't explained what my memories or understanding of reasons why I was there. I wasn't telling them about the nightmares. I wasn't having a wink of sleep. You don't come out of intensive care and sleep. It's an impossibility. Your brain doesn't work, your mind doesn't work, your body doesn't work. You can't even think straight. And I remember that evening as my parents left, they would come in every single day to see me from midday to about 7 o'clock and stay with me, sit with me, talk to me. And when they left, I realised that it wasn't necessarily guaranteed that I would get out of that hospital alive. I realised that there was no point in me crying. It was a case that I just had to trust the doctors, trust the medicine, and play my role and try as hard as I could. I wouldn't let my friends come to visit me or my family. I was scared that if they saw me, it would be real. I was scared that if they saw me, I wouldn't be able to hide the reality and keep a brave face and just focus on getting out of hospital. And I've apologised to them since. But I was also scared that I wouldn't make it, and I didn't want them to remember me like that, as an emaciated, frail, broken person. When it came to the time to be discharged, I wasn't discharged to go home. I was discharged under the care of my parents. I was unable to care for myself. I was unable to wash myself, dress myself, and was utterly reliant on my parents for all of my needs. So at the age of 35, my mother was having to wash me, dress me, do everything for me. I was having my abdomen packed on a daily basis, either going to the doctor's surgery or having a district nurse. I was having to have daily blood tests. And I was frail at about 40 kilograms, so trying as well to put on weight, gain strength, gain mobility. And that's the hard part, because getting out of hospital had been the focus, but actually getting out of hospital was then also about facing reality, because I'd avoided seeing myself for the duration of hospital. But getting home, I realised I was far from well. I was far from being the person I was. I wasn't working. I didn't look like me. I couldn't speak properly, so I didn't sound like me. I was unable to do anything that the old me could do. So I had no identity, no purpose, and that's hard. And at the same time, I was trying to deal with all my memories, trying to process what happened, trying to understand it. I wasn't sleeping, I was having nightmares. And when I say not sleeping, that's not a going to bed and just sort of tossing and turning. That's lying in bed, having absolutely no sleep all night, because your brain is desperately trying to piece things together. And over sort of the following months, I gained physical strength, physiotherapy, family being very supportive. I fought to go back to work, even though I couldn't even carry a laptop. I think my boss was humouring me, and my friends were very supportive. And I was only able to manage half a day at work to start with, a week, and then I would spend the next few days in bed. But what happens is, it seems as your body gets stronger, your brain suddenly goes, okay, I can start to process this. And that's when things became really hard, because you try to do the normal things and try to get a semblance of your old life back, and you think you'll feel normal again. And when you don't feel normal and your body still feels different, even though you've tried to go back to work, you've tried to move back home, you've tried to learn to drive again, and those things don't happen, it becomes very hard. I was still having nightmares. And I think that's when the PTSD really started to kick in. And very luckily, I was referred to the care of the Royal Berkshire, where they have a fantastic ICU rehab team. And I remember a nurse there saying to me, Alison, every cell in your body was trying to fight to survive. You're on life support. Why do you think your brain was any different? And I think I needed someone to say that to me for me to understand it, because I thought it was a case of just getting on with things. If I tried hard enough and forced my body and forced my brain, it's fine, I'd get on with it. It wasn't a big deal. But that kind of then suddenly made sense. And understanding what happened and why things happened became a really important part of trying to process and recover and heal. And it takes a long time. We're 6 years post the accident. People say, "Oh, you fully recovered?" And what does that really mean? My body is never going to be the same. It's going to be damaged forever, but it's also a part of accepting that damage and trying to move on and live my life, which is also hard. I've had lots of counselling for PTSD. I've had lots of CBT to deal with the physical changes, the exhaustion, the pain. And also then part of this is trying to accept the failings, the errors, the safety issues that torment you because you have this horrible fear that it will happen to other people. And that is as much as part of the recovery as perhaps learning to walk again, and then being able to move on with the rest of my life.